Have you heard of a disease so deadly it can have a fatality rate of up to 88%? Today, we're talking about Marburg virus disease, a rare but dangerous illness that's a close cousin to Ebola. In fact, they're so similar clinically that it's often hard to tell them apart without lab tests. So, what exactly is the Marburg virus? It's a member of the same virus family as Ebola, and it causes a severe hemorrhagic fever. The disease first appeared back in 1967 in Germany and Serbia, linked to laboratory work with African green monkeys imported from Uganda. Since then, it's caused outbreaks and sporadic cases in several African countries, with recent outbreaks reported in Rwanda and Tanzania. Where does it come from? The natural home for the Marburg virus is the Egyptian russet fruit bat. Humans usually get infected after spending a long time in mines or caves where these bat colonies live. Once a person is infected, the virus spreads like wildfire through human-to-human contact. This happens through direct contact with the blood, secretions, organs, or other bodily fluids of an infected person. It can even spread through contaminated surfaces, like bedding and clothing. This is why healthcare workers are at such high risk, especially if strict infection control isn't followed. Burial ceremonies that involve direct contact with the deceased can also tragically spread the virus further. A crucial point is that people aren't infectious until they show symptoms, but they remain contagious as long as the virus is in their blood. What does it feel like to have Marburg virus disease? The illness starts suddenly. It hits you with a high fever, a severe headache, and an overwhelming feeling of being unwell. Muscle aches are common. By the third day, many experience severe watery diarrhea, abdominal pain, nausea, and vomiting. A Nanichi rash might also appear. After about 5 days, things can get much worse. This is when hemorrhagic symptoms can start bleeding from the nose, gums, and even in vomit and feces. The central nervous system can be affected, leading to confusion, irritability, and aggression. For those who don't survive, death usually occurs between 8 and 9 days after symptoms begin, typically from severe blood loss and shock. The incubation period, from infection to the first sign of symptoms, can be anywhere from 2 to 21 days. Diagnosing Marburg is tricky because it looks like so many other illnesses, such as malaria or typhoid fever. Confirmation requires specific lab tests like PCR assays. These samples are extremely hazardous and must be handled in maximum containment laboratories by highly trained staff. So, how do we treat it? This is the tough part. Currently, there are no approved vaccines or antiviral treatments specifically for Marburg. However, early and intensive supportive care is a game changer. Rehydrating patients and treating their specific symptoms can dramatically improve survival rates. Researchers are actively working on candidate vaccines and antibody treatments, which offer hope for the future. Prevention is our most powerful tool. Community engagement is absolutely key. The best way to reduce human transmission is by raising awareness about the risks and the protective measures people can take. This means reducing exposure to bat-infested caves and mines, and if you must go there, wearing protective gear like gloves and masks is essential. During an outbreak, all animal products, especially blood and meat, must be thoroughly cooked. To stop human-to-human spread, avoiding close physical contact with infected patients is vital. Anyone suspected of having Marburg should be isolated and cared for in a treatment center. Safe and dignified burials are also critical to stop the chain of transmission. Healthcare workers must use standard precautions with every patient, including hand hygiene and personal protective equipment. For survivors, the journey isn't over when the virus is gone from their blood. The virus can persist in immune-privileged sites like the testicles and eyes. It's been known to be transmitted through semen up to 7 weeks after recovery. Therefore, survivors are advised to practice safe sex or participate in semen testing programs until they get to consecutive negative results. Survivors and their families need our compassion and support to reintegrate into their communities and deal with any long-term physical or psychological effects. The World Health Organization is on the front lines, helping at-risk countries prepare for and respond to outbreaks. This involves everything from surveillance and case management to community engagement and logistical support. Marburg is a formidable foe, but with knowledge, vigilance, and global cooperation, we can control its spread and save lives. Thanks for watching, and don't forget to follow for more important health updates.